Medication administration errors, Brooke Futrell. So for the change process steps, here are the 7 steps. 1 is identify the problem. 2 is collect necessary data and information. 3 is select and analyze the data. 4 is develop a plan for change. 5 is identify supporters and opposers. 6 is implement interventions to achieve desired change. And 7 is to evaluate the effectiveness of the change. So what is the problem? The problem is medication errors frequently happening in nursing. So medication errors remain one of the most common causes of unintended harm to patients. So it's really important when you're putting people in harm or putting them in maybe life-threatening situations sometimes. But one of the problems that I found when I was doing my preceptor at St. Mary's is I saw nurses, they would pull all the meds for all 6 patients, and she would take literally, so the first patient's room, she took all 6 patients' medicine into that one room, and then she would go to the next room, and then she would go to the next room. So like that's definitely like a problem and definitely increases the chance for medication error to occur. So in some articles that I looked up, I found why do medication errors happen, and the article supported that inexperience, rushing, technology, staffing, patient acuity, and distractions and interruptions are the top of why medication errors do happen. Also in the articles, I found how often do medication errors occur. So it showed that 1.3 million people are injured by medication errors annually, and that's like a huge number. In one of the articles, it was 168 people, and 55% of them had made a medication error, and then another 23% had not reported the error. And that's a problem because that can take away like from them learning from that experience and getting the help that they need, like to understand why it happened, and for the patient. At least one error, in another article, at least one error was found in 22% of administered medication. So out of 1,058, 235 were errors. So which QSIN competencies apply here? I felt that safety and quality improvement, obviously things need to be done to make the care for our patients better. So quality improvement, getting better on medication administration and the issue, and then safety, giving a patient a medicine that's not theirs and it could seriously harm them, whether it be life-threatening or not. It can cause damage to the body. So when I was collecting and analyzing the data, I got 5 scholarly research articles that were analyzed and chosen on this issue. The main topics of the articles, their focuses were on why medication errors were being made, how often medication errors were being made, and then interventions used to reduce the amount of errors that was being made. So in one of the steps, you need to identify your supporters and opposers, so who is with you and who is against you. People who are more likely to be with you are nurses who want to do better, they want to better themselves, nurses who can adapt to change and tolerate it well. If you can adapt to change, you accept the change more often. Nurses who have made the mistake in the past, so they know how important and how dangerous it can be. People who are more likely to be against you are nurses who don't adapt to change well. People that don't adapt to change well they try to stay clear of it. Nurses who haven't made the mistake, so they don't understand the severity of it, and then like nurses who are in routine and they just don't want to disrupt that. So people who are they've gotten a routine of doing things a certain way and they really don't want to change it. So interventions to achieve the main goal. So key themes for improving the education on this was more practice in varied clinical areas, intensive pharmacological preparation, practical instruction and functioning with the healthcare environment, and coping after making medication errors. Doing these things will help reduce the amount of medication errors. Another article showed reducing the number of nurses shift during the month and increasing the number of personnel per shift is recommended. And overall perceived treatment for making medication errors was supportive environments where nurses were generally treated with respect, fair treatment, and understanding instead of just dissing them and like just attacking them. Also, when with the evaluation, why is it important to evaluate the effectiveness of change? You want to evaluate it to see if the change was made that you wanted to. Was it the right choice? Like, did you achieve what you wanted to do? To see if the strategies used were effective, and to use it in the future. So if it worked, that's great, and then maybe you can apply it for future problems. And then to motivate others. So if you create a change and people see that it did better and it worked, maybe it'll motivate them to kind of see where there's problems and then improve. So like have quality improvement. Also, back to the interventions, like developing a plan of care. So when developing the plan of change, these are things that you would want to keep in mind and maybe use to develop that plan. And also, I thought an interesting thing in one of my articles, it showed about the room of errors. So we got to do that this past semester, and it was interesting to be able to like go in and try to find the errors. It makes you more aware that errors are out there, and then it shows how easily errors can be missed. So I thought it was cool that there was an article to back up, and we got to do it ourselves. So some questions to take with you is, how do you think this issue affects patient care? The second one is, how well are you to adapt to change? And the third are, what ideas may you have to solve the issue? And here are my references.